So this is going to be a quick demo video on how to do the reception and triage routine in the emergency department. There is a more detailed explanation as to what to do and when in a longer version of this video. This is strictly just, a quick demonstration of how it's done. Okay, so patient comes through the door. You do want to make sure that you ask the questions for ARI, whether they're COVID positive or all those things, if they have cold symptoms, and make sure that you're donning appropriate PPE before you engage into this activity. And that will get documented later in the routine, but you do want to ask it at this point before you start doing your routine with the patient. So health card is the preferred method of identifying the patient. However, if you do need to use the name and date of birth, you can do that. It just creates a little bit of extra steps, but it's there. So patient arrives in my department, gives me her health card number. So I'm going to go ahead and click on the reception routine. I'm going to go ahead and put in that health card number that she just gave me. Do want to search for the patient. I automatically get the patient. I click on them. That window that just popped up is something we can ignore. And then we are going to put in the stated complaint. And you do need a CDIS complaint. That has to be a CDIS complaint for the chief complaint. And then here at the triage level, you do want to have it put a baseline of 5, regardless of the patient, because it's just a placeholder. Very, very important that you hit the save button before you go to the triage. You do want to print a bracelet for your patient and apply it to your patient here. This triggered order set directive is something that you want to keep in mind, but you're not going to apply it here at this point. You're going to do it later. So we're going to go ahead and skip that. And then we're going to go to our ECTAS app. So now we've got our patient here in ECTAS. We're going to hit this icon here to open up the routine. You'll notice that because I've previously typed things, I've got options here of previous, and I do have this patient. So I'm going to go ahead and take advantage of that for the sake of quick. And then I'm going to go see this complaint. So for subjective data, when you hit on the subjective data, it'll automatically trigger some assessments based on what you put in as a complaint. So here it wants to have your tetanus. Do not ignore those. Do add them if you see them pop up. And then so I'm going to give a description. So and that's probably pretty adequate there. So then I'm going to describe objectively what I'm seeing when I see the data. Great toe, active bleeding in ED. So now I've got that information there. So the next tab, so those 4 tabs are the only ones we need to deal with. And this next tab, so again, because I put in information before, I do have options. So I'm going to put that, I cleansed the wound, and I'm going to put that in initiating a medical directive, because I will want to give this patient something for pain, which is part of that directive that is going to be there. So then I'm going to go ahead and proceed to my vitals. So putting in your vitals. So again, I've got options there that have pre-populated from previous triages, and it is perfectly okay if the number that you're looking for is there to utilize that number. So I'm going to, for the sake of expediting this situation, I'm going to go ahead and pick numbers that are popping up here. I would do a set of vitals on my patient and then do what I need to do. So you will notice in the blood pressure, I can add a second blood pressure. If this was a cardiac assessment, I would want to do a right and left on the patient. So you do have that option. And then I'm going to put in my saturations. Oops, sorry, and I do want that to be indicated on the room air. You do want to add those details if you can. So she tells me her pain is 8 on 10, which is probably a reasonable amount of pain after dropping something on her foot and having a cut. And you can describe pain a little bit more clearly on those little icons if you go to them. And then I do like to have a GCS on patients, especially if the patient has the potential to deteriorate. You want to have those. Trauma in patients and head injury patients um, is not optional. You do need a GCS on those patients. And then don't disregard any of these extras, like cap refill for a really sick patient can bump their triage. Putting in a blood glucose, you can scan the patient's bracelet that you just put on them and do a blood glucose and triage. Weight we don't deal with here. High mechanism of injury is automatically bumps person to a 2 if they qualify, and you do have a little icon here to see what qualifies as that. Same thing as immunocompromised and blood disorders. Last piece is you want to go to your modifiers. You want to make sure that you're not disregarding anything that is additional to your patient that might increase their score. So frailty modifier is one that if a patient's a 4 or 5, they may automatically get bumped to a 3 if they're mobility compromised and requiring extra care. So do not ignore those. You also have the option to put in previous visits here. So if the patient has a visit and you want to previously, and it relates to this one, and you want to add those details, you can go ahead and click add to those details and it'll add it to your subjective data there. And then that's it for triage. We're going to go ahead and click OK. You'll notice that there's more than one. That's because of this recording process. I have multiple attempts at this. That's all that is. So I'm going to go back to my EC tasks. So you're going to notice that my triage carried over and that the patient is now registered. So that goes automatically to registration and they automatically do the registration piece. So the patient is now registered. So the last piece of the triage is to go to this triage routine up here. And I'm going to open that up, and then you're going to do your screening pieces. So you've got 4 pieces here to screen. The patient has triggered an ISAR because they're over the age of 65. So you do have to do those. I like to do them all at the same time. Go ahead and click one of the pencils, and then you're going to go through the questions. So the patient does not have any infection control, have any cold symptoms, cough, diarrhea, rashes, any of those things. Not recently been exposed to COVID or had COVID. Has not required any isolation for any illness, so we're good with doing routine practices on the patient. The patient has not had falls. She's actually a pretty solid little 80-year-old, so we're not worried about any safety concerns. And she is sweet as pie, so we're not worried about violence with this patient. She tells me that she is 5'6", and I'm going to go ahead and put in that information. It is important that we put in weights and heights on our patients, and she tells me that she's 140 pounds. So I'm going to put that in there as well. So the ISAR, did she have any problems before the injury? No, she didn't. Has she had recent problems? No, she has not. Has she been admitted to the hospital in the last 6 months? No, she has not. She has no vision issues. So when they ask this vision question, they refer to vision problems that cannot be corrected with lenses or surgery. So if the patient's wearing glasses, that does not qualify as vision. We're talking about permanent visual impairments that will affect the patient's functioning. And here, no problems with memory, and we are perfectly, their medications, they only have a couple medications. So that is all we need for the ISAR. You don't want to replace the height and weight on your patient. Now that you've completed those, you're going to go down to allergies, and you're going to verify the patient's allergies and add some if you need to. And we're going to do that. And then we want special indicators. If you need to add them, you'll do them there. And then you're going to go to the home medication list. Ask the patient, are you still taking this medication? Did you take it today? Yeah, I'm taking it. How about the Ketorolac? I am taking it when I need it, but I didn't take it until like last week. Okay, so we'll go ahead and take it last week. And levodopa, yeah, I took that this morning. Pantoloc, yeah, I took that this morning. Perindopril, oh, that one I take, but I changed the dose. It is now, instead of being 2 milligrams, it's 4 milligrams. Okay, let's make sure that we fix that in your profile right now. Sorry, I accidentally clicked on that extra thing. And then we're going to go ahead, she took it today, and we're happy with that. So now that I've verified all those medications, that's done. And you don't want to do that on every patient that comes through. And that pre-populates once they've been seen before. You do want to add a pharmacy if you have a pharmacy, and that's it for the triage routine here. So back to Meditech now. So there's nothing left to do with this patient other than trigger a directive if we wanted to give her something for pain. and then when we bring the patient into the department, we'll do what we need to do. Can show you the directive. So when I click on orders here, I'm going to go ahead and put medical directives as the subject. So automatically these suggested directives pop up. So I don't even have to look for them. And I am going to go ahead and implement these things. So I'm going to do BPMH and something for pain. I'm going to give this lady some ibuprofen, and I can put lidocaine gel on the injury. If she needed a tetanus shot, I would actually go ahead and put that in as an order as well. And now that I've ordered those things, I can actually go over to my MAR. And I can go ahead and administer those medications to the patient. I'm going to acknowledge them. I'm going to cheat a little bit and do my manual barcode here because I don't have a bracelet to scan actually during this video. And I'm going to go ahead and administer that, and I am going to give her some ibuprofen as well because I want her to be comfortable while she waits to see the doctor. And now that I've done that, I can go ahead and click OK and save. I'm going to put in my PIN to sign my administration of the medication. And then I'm going to go ahead back to my list or my status board. And this patient is ready to bring into the department. And that's it. Triage routine complete.